Hi, welcome back. My name is Ben Nowell. I'm the Director of Patient-Centered Research for the Global Healthy Living Foundation and CreakyJoints. And I'm one of the co-principal investigators for Arthritis Power, our patient-powered research network. So it is a pleasure to get to spend some time here today talking to Kayla Jordon, who's with the University of Texas at Austin. And she's a social psychologist. So we're going to talk a little bit about one of the abstracts that we are presenting here at ACR this year. It's been a very busy meeting, and I'm excited to get to take some time to talk to Kayla about one of our studies. I've been running around. We have stuff, I can't even remember how many posters and a few presentations that we're part of this year. So this is one of the most interesting. And we've got a lot of attention as we were standing at the poster this morning. We literally just came upstairs from spending 2 hours. Our feet were happy to sit down in these comfortable chairs to get a little rest. Because we've been sitting, talking to people as they came and asked us questions about the study that we worked on. So I guess we'll start. Kayla, can you just tell us a little bit about yourself, and then we'll talk a little bit about the study. But first, if you want to introduce yourself, your background, what you're interested in, what you're doing now.
So my name's Kayla Jordon. I'm a student at University of Texas at Austin. I work with Dr. James Pennebaker, and our work primarily focuses on how we can use language and language analysis to better understand people's psychology. So the words people use, and without even really thinking about sometimes, can be very informative to their psychological states, what they're thinking about, what their attention is on. And so here we kind of use that to focus on this health issue, specifically looking at how patients and professionals might talk about gout and what disconnect there could be there.
Awesome. So I just want to point out for people that it's a little bit scary that we can, in casual conversation, meanwhile there are social psychologists assessing us and making some sort of evaluations about our psychology based on the words that we're using, the frequency of particular words in our vocabulary. So that's the basis of this, the field that Kayla works in with Jamie Pennebaker. And do you remember? There's a book that your boss wrote. What's it called?
The Secret Life of Pronouns.
That's right.
So we never think about how we use pronouns, if we say I or we or he or she, but the way we use those types of words and even like articles and prepositions can be very informative to like who we're attending to, how we're working through a problem and things like that. Great,
thanks. So as Kayla mentioned, as you mentioned, we did this study, and actually it was our executive director, Lou Tharp, who got really interested after meeting Jamie Pennebaker at another meeting or conference. And what we wanted to understand is the difference in the way that people living with gout, talk about that disease or that condition versus the way that health professionals or websites that are produced, with sort of expertise from clinicians, from industry, things like WebMD. We wanted to see the difference and see if there was a gap or disconnect in the way that these two groups were talking about these things. So our poster, the poster downstairs, we changed it a little bit from the name of the abstract, but it was called Different Stories, Same Disease, right?
Yeah.
So Kayla, tell us a little bit about, I know we worked on this together, but Kayla is like you're the methodological genius in all of this. So tell us a little bit about what we did and then what we learned.
So basically, one of the great things for many fields of science recently has been like the prevalence of the internet and just how much people are on the internet and posting things on the internet. So what we wanted to do is we have all these sites from health foundations and pharmaceutical companies and other types of medical professionals that talk about these diseases, but we also have patients blogging about their experiences, as well as social media sites like Twitter and Reddit, where people not only talk about their experiences, but communicate with others, asking questions and trying to create a community. So what we did was we collected data from each of these three sites, just looking at the words that people used, and then first just looking at what were the frequent words, and we noticed that there is some disconnect between the professional and the patient sites with medical professionals obviously being kind of more formal and using a lot of medical terms, whereas patients are really focusing on the day-to-day, a lot of the lifestyle and diet issues involved in gout. And if we look at the themes that are involved in each of these sites, we really see that with diet being a very central theme for patients that isn't really seen as much for professional sites, focus more on just the general risk factors, not necessarily those specific issues.
Great, thanks. So one of the things I think is this is such a fascinating area, because I know, myself as a patient, myself as just a human being, as an individual, as a person, I always want to know what are the things that I have control over, that I can actually do at home. I love cooking. I love being in my kitchen all the time, right? I love food. I can't lie about that. And so what we found here is that, like you said, from the analysis, what it seems like, based on Reddit, was the social media platform, and blogs, patient blog posts about gout, we found that people talked a lot about ingestion, right? About food, what they drink. And it seems like patients with gout, when it comes to gout, are really understanding it primarily as a disease of diet and lifestyle. And the treatment for it is also, by patients at least, believed to be something that can be controlled or affected primarily by diet and lifestyle, based on the language that we're seeing in those posts, right? So again, social psychologists are analyzing these words, doing frequency, like word counts, counting the frequency of these words to determine different psychological domains. But what we know from rheumatologists, from clinicians who treat gout, is that apparently you can really only lower the level of urate, which creates uric acid, which is what elevated rates of uric acid is what causes gout. You can only lower that by about 0.5 milligram per deciliter with diet. And if the normal range is 5.5 or 6, and someone has an elevated level that's upwards of 9 or 10, and we're only bringing it down by 0.5 with diet, that means there needs to be treatment in most cases, right, in order to control gout. So that's really interesting, I think, to see that there's such a disconnect between the way that patients are talking about gout or thinking about gout, conceptualizing it, versus how medical professionals, healthcare professionals are talking about it or thinking about treating the disease or controlling the disease. It's a chronic condition that we know has very effective treatments that go beyond diet and lifestyle. So anyway, so this study is such an interesting first step in seeing that, there is providing some evidence that, there is some real differences in the way that that people talk to each other, people who have gout or are trying to understand gout online talk to each other, versus the way that health professionals are communicating about the disease and the treatment. What do you think? Anything else to say about this or to add about the study?
I think it's a very interesting first step, and we can really, by doing these types of analysis in the medical field, can give medical professionals a better sense of where their patients might be coming from, and potentially help them really communicate better the message and get people the information they need in a way they can understand it.
I totally agree with you. Yes, totally. Because the whole point is, we want people to do what they want to do with their lives, live happy, productive lives. Gout can be pretty debilitating, and we don't want people to go to extremes, like getting a toe amputated or something, because they aren't on the proper regimen to control or manage a chronic condition like gout, which is a form, as we've heard in another poster, actually, our colleague from New Zealand, even just changing what we call gout makes a difference in the way people conceptualize the condition, right? She compared, I think, uric acid crystal arthritis versus gout, and really, changed completely, because gout is a term that's been around for hundreds of years. People have kind of clear, colorful depictions of what gout looks like, and it's so lodged in our brains, it seems like, that it's associated with eating rich, delicious foods or beer or whatever. But that's really only half the story, right? Diet is only half the story. So Anyway, so I think our next step is going to be to test out different approaches to messaging and communication, right? Do you want to say anything about it?
Yeah, so we know in the psychology realm, this has been a big area in political psychology, looking at how politicians tailor their messages to get their point across. And we know that the way messages are framed can be very influential on how people receive them and whether or not they really incorporate that information into their daily lives. So by taking some of the past research in this area that's been done in other domains, it's likely we can help to tailor health messages that may be more effective at getting people to adhere to their treatment regimen.
Right, exactly, because that's the whole goal of this, is we want people to be, again, to live healthy lives. And in order to do that with a chronic condition like gout, there are definitely effective treatments out there. And we just want people to make decisions based on actual facts and not sort of hearsay or guessing, because there's good evidence that stuff like certain medications actually work really well to treat gout. Thank goodness, right? It's a super treatable condition. So thanks very much, Kayla. I really appreciate the time to talk to you. I'm so glad you came from Austin to be here at this conference with us, and we're so thrilled to work with you on our research going forward as well.
Yeah, glad to be of help.
Thanks. So thanks very much, and we'll take a 5-minute intermission or so, and we'll be back with more information from the American College of Rheumatology scientific meeting here in lovely San Diego, California. Thanks.